Hi everybody, I'm Dr. Gavin Scriven. People call me Dr. Gav, and with me is the founder of the non-surgical penis augmentation procedure we call Caliber, Dr. Jayson Oates.
Thanks, Dr. Gav, and together we are the Dick Doctors, and we are going to be talking about all things penis. Our area of expertise is injectable penis augmentation. There's a lot to talk about penises, and together, myself and Dr. Gavin will be doing that.
Welcome everybody, I'm Dr. Gavin and I'm here with Dr. Jayson from Perth. We are the Caliber Clinic, Confidence Changes Everything, and we're here to talk about penises today. And thanks for joining me today.
Thanks, Dr. Gav. And just to remind everybody that confidence changes everything. So Dr. Gav, today we're talking about erectile dysfunction.
Yes, we are. And it's, something that we talk a lot about with our patients, being the Dick Doctors. And it's unfortunately a very common problem, and have a lot of people out there suffering with erectile dysfunction and not knowing where to turn or who to talk to. I guess my advice is always the first point of call would be your GP. Don't know if you agree with that, Dr. Jayson?
Yeah, well, the numbers seem to indicate that 50% of the men over the age of 50, in fact, they even say starting from the age of 40, are having some erectile dysfunction. So the first thing would be to see your GP, because it's not just the function of your penis that you're worried about. With the erection, obviously, it's the flow of blood into the penis. And the blood vessels in your heart are about the same size as the blood vessels in your penis. And so if you're not getting enough blood into the penis, one of the things that your GP may want to check out is the blood flow to your heart. So I guess that's the sort of thing that, as a GP, you'd be wanting to ask some questions about.
Yeah, definitely. And that's really interesting. You said it's 50% of men over the age of 50.
Well, the study that I read was suggesting over the age of 40.
Over the age of 40,
I couldn't believe that. Now, I'm over the age of 50, and that would be a concern if that many guys are having it. But I don't think it means that none of them can get an erection. It just means that they aren't getting the erections and maintaining the erections.
Not like they used to when they were 18.
Yeah, and for the function that they wish to achieve with their erection.
Sure. Yeah. Okay. Well, that makes more sense then. But yeah, I'm sure if there was a survey put out, if your erection quality and the hardness and the duration of your erection, is it the same as when you're 18? I'm sure a lot of people would put their hands up and say it wasn't. So yeah, I think starting with the GP, looking at simple things like your cholesterol levels, that of course affect your cardiovascular system, looking at your fasting glucose levals, because a risk of diabetes.
Diabetes is the other sort of big one. I guess the two major sort of functional things that can happen in the penis is a change to the blood flow or a change to the nervous supply. And so the cholesterol and the buildup of like atherosclerosis, decreasing that blood flow into the penis is one. And if the nerves aren't working as well and you're not getting that nervous impulse that comes with the generation of an erection, and nerve problems are very, very common in diabetes. And of course, diabetes is becoming much more common with obesity and the type 2 diabetes.
Yeah, exactly. And of course, in general practice, without screening, not only screening for diabetes in really everyone over the age of 30 these days. Of course, with every lady who goes through pregnancy, they get screened for gestational diabetes. Not that this is a problem with women, but it's very prevalent, unfortunately, in our society today. And I guess most guys wouldn't realize that could affect the quality of their erections. But most people understand it affects things like their eyes and their feet with the smaller blood vessels. And we do foot checks for diabetics, but maybe, unfortunately, part of the common practice should be doing an erectile dysfunction or penis check for people who are pre-diabetic or diabetic.
Yeah, well, maybe if we spoke to younger people and said that, one of the major causes, I think it's around about a quarter of erectile dysfunction is put down to diabetes. They said you're going to lose your ability to get an erection. Maybe more guys would be out there exercising, watching their diet and losing weight.
Yeah, sugar would be off the shelves in their homes.
Yeah, that's right. So I guess the other thing that guys often think about and want to put it down to is a change in their testosterone levels, especially as they're getting into their 50s. Do you check guys' testosterone levels?
Yeah, as a GP, we do routinely check testosterone levels if someone's come in for to talk about erectile dysfunction. But I do let everyone know that it's not a common cause of erectile dysfunction. It's actually one of the rarer causes, but it's probably one of the first things people think about, I guess, especially guys. They think it has something to do with their manlyhood, their testosterone levels. And yes, of course it's a possibility. And if you have low testosterone, that does affect erectile function, but it's not a common cause. So,
yes, you may have erectile dysfunction and you may have a low testosterone level, but it doesn't necessarily mean that that's causative.
Exactly.
And yes, if you sort of go on to testosterone, you might sort of increase in muscle mass, and possibly you're going to lose a little bit of weight. Maybe you'll have an improvement in your erectile performance. But once you start on testosterone, my understanding is it's hard to get off of it because once you stop that testosterone, your natural production of testosterone has been suppressed. And you can't even get to the point where your testicles shrink, which doesn't sound great. And then if you stop your testosterone supplements, then you really feel bad because it takes time for your natural testosterone level to sort of come back up.
Yes, so I think it's important to understand that there are many other causes other than low testosterone. Probably the most common ones we've talked about already are the high cholesterol, diabetes, high blood pressure, anything that affects the cardiovascular system in a negative way. So it's important that's why I said at the very beginning, start with your health checks, go to your GP, find out if your cardiovascular health is in check, and looking at the blood flow in your whole body is important for erectile dysfunction. And of course, the other major component we haven't mentioned is the psychological component, which is probably the other major cause of erectile dysfunction. And I guess is part of the clinical history that we take as doctors. If we suspect that is the case, then that's a little bit more tricky to deal with. And we still have to go through all the other checks and balances before we can say it is psychogenic in nature. But it's a very important one to understand.
Absolutely. I think there was a time 30 years ago where sort of the majority of erectile dysfunction was sort of put down more to psychological sort of things. It's the stress of work, that sort of thing. And then we started to move more into the physiological, the blood vessels and the nerves, those sorts of things. And then, of course, we started getting the little blue tablets, which would fix it. And then everything was sort of put down to being a physical sort of cause. And I think now we're sort of back into that sort of medium sort of thing where
understanding it. But there's multiple contributing factors.
And of course, part of the problem is, if a guy's suffering from depression, stress, that sort of thing, is you might get put onto an antidepressant medications. And what's one of the most common complications of some of your antidepressant medications?
Erectile dysfunction. That's right.
And so then you're in that sticky situation where maybe somebody does have an element of depression and they've got erectile dysfunction. And do you continue with the medication? Do you stop the medication? It's not an easy situation to be in.
And of course,
blood pressure medications as well. Some of them, it's a common complication. I think that's part of the history is sort of just checking what they're on and whether it's what we call iatrogenic. It's been caused by something that the doctor's doing to them.
So many things that could really affect a man's erection. Certain diseases, certain medications, psychological conditions. So it's multifactorial, and of course, as you said, one can play into the other. If you have a slight decrease in erectile function because your cardiovascular health is not as good, that can make you feel a bit down, and it can become a psychological issue after a while and feel performance anxiety, and then that feeds in, sort of goes in a cycle, as they say.
Well, one of the things I tell all of my guys is exercise more. Exercise improves your cardiovascular health. It's a great natural way of improving your testosterone level. It's actually shown to be almost as good for depression as the antidepressant medications.
Definitely.
Yeah, if you look better, especially if you can lose some of that tummy, it makes your penis look bigger as well. So it makes you look more attractive all around. You're more likely to get an erection if you exercise more. So yeah, there's no downside to exercising.
Excellent. Well, if we can take one thing out of today, I think we're both running home today, Dr. Jayson. All right.
I only live about 5 minutes away, so it's not so bad.
And so, yeah, we've touched on a lot of the causes, but you did mention one of the solutions previously was the blue pill.
Yes. Yeah. So, yes, Viagra, as everybody knows, is that magic blue pill that can restore erections. And it's a use as you need it sort of thing. So it's not something that you're taking every day. And there are other versions like Cialis being, perhaps the other common sort of one where, it has Cialis then has an effect for several days. So you don't have to be popping it as you need it. Whereas Viagra, yeah, you're very much like you're going to need an erection, right? Time to take the blue pill.
The show is happening in the next hour.
Yes. Yeah.
And so what was the idea behind the medications is to increase the blood flow though, right?
Yes. Yeah, that's sort of where they came from. They were a sort of an offshoot of when they were looking for another blood pressure treatment medication. And its side effect was dilating blood vessels into the penis and getting an increased blood flow into the penis and creating an erection. And then that leads to some of the complications of Viagra, which is that pounding vascular headache because the blood vessels sort of dilated in your brain, lowering your blood pressure, and then having to be really careful about mixing Viagra and some other blood pressure lowering medications, or famously the nitroglycerin paste for a heart attack. Yeah, so if you've had a Viagra, they can't use the GTN paste because it drops your blood pressure so much that
you might hit the floor.
Yeah.
Yeah.
So that's great. Unfortunately, Viagra doesn't suit everybody. Comes in, I think there's 3 separate strengths, dosages. So some guys have to go up and up and up, but you can get to the maximum dose and still not have a benefit. Or the side effects can be too much.
And it's obviously the other medication we mentioned before. Some of them can be quite costly, ongoing if they're using it on a regular basis. So and some people don't like the idea of medications and side effects. So I guess that sort of brings us to what other options are out there for erectile dysfunction.
Well, so the next thing after the tablets is the injections. So more definite is to do the injections into the penis, which then dilate the blood vessels there, and can almost definitely create an erection in most guys. It means, it's a bit more intrusive, obviously, into the whole sexual adventure. If you've got to say, excuse me, I've just got to put a needle into my penis so I can get an erection.
Kills the mood a little bit.
Yeah, it'd kill my mood. It'd be like, it's Christmas, it's time to do it.
But they can be highly effective, obviously, and bypass some of those side effects that we get from the oral medications.
Yeah. The downside potentially of it is then having an erection that lasts too long, priapism, and that can be a serious issue. It can be extremely painful for guys if it lasts, say, longer than 4 hours. I had a patient come and see me, and this was unrelated to medications. It was actually a blood clotting problem. He had an erection for 4 days.
Ooh.
4 days.
Yeah.
And some guys might be thinking, hey, that sounds great. No, not great. Incredibly painful, incredibly embarrassing, And unfortunately, that was his last erection. It damages the nerves and the blood vessels in there. And so then he was looking for a solution for now truly serious erectile dysfunction.
And so the injectables may not be for everyone either, for a number of reasons. So then, you know, what next really after that? I guess there are some more novel treatments out there that have some evidence.
Yeah. So there's a few things. The next real medical treatment, obviously, is the surgical sort of one where they can either do a flexi rod, or probably more commonly nowadays is the pumps. And the pump can be either in the scrotum or in your groin, and you've actually got to pump that fluid into a bag that's inside the penis, and that then creates an erection. Now, this is obviously sort of a no going back type thing.
Severe cases.
It's severe sort of cases, and if nothing else has worked, then if that's the way of getting an erection, that's the way.
Sure.
Then we're starting to get into perhaps some more novel and at this stage still experimental treatments. There is a urologist in Egypt who's published a couple of papers on injecting Botox into the penis. So this was an interesting thing.
Yeah, counterintuitive, I imagine.
It was like, you know, trying to get the wrinkles out, maybe.
Relaxing the penis doesn't.
No, actually.
A lot of people would ask, would that relax the penis?
Yeah, well, no, maybe relaxed is good. In fact, what it does is it relaxes the muscles around the blood vessels that are restricting the blood flow in there. And so it took a urologist who really understood the physiology of erection. And of course, we use Botox to relax muscles in the face and get rid of wrinkles, but we also use it in places like the armpit to reduce sweating. It's a particular nerve and a particular, what we call neurotransmitter, that releases that chemical message from the nerve to the muscle, or in the armpit, the sweat gland. In the penis, it's the same neurotransmitter going to that muscle that keeps the blood vessels closed down and restricts the arterial blood flow in. So we came up with this idea of injecting Botox in with moderate success, not great success, but the idea of success was perhaps to be able to lower your dose of Viagra, or if you could shift from doing an injectable treatment, go down to something like a tablet to be able to create an erection. So some benefit. I've used it on a few guys with limited benefit. For some guys, it perhaps reduces shrinkage, and maybe we'll talk about shrinkage as a separate sort of topic. But perhaps it increases that blood flow into the penis. That's still very experimental at this stage.
And then, of course, we offer something in our clinics, both of us, which has a lot of scientific sort of evidence behind it in certain areas of medicine, maybe not so much in this area, which is platelet-rich plasma.
Yes.
That some people know it as the P shot, PRP, penile rejuvenation, many different names out there. People might recognize it by, but essentially we're taking people's own blood, spinning it off down into its components and separating the platelets out of the blood into platelet-rich plasma, so a higher concentration of platelets than you would find in your normal blood. And we're injecting these back into the penis to stimulate some kind of rejuvenation. Talk us through that a little bit more, Dr. Jayson.
Yeah, so platelets have a couple of main functions. They start the clotting process, so you get cut and it helps stop your bleeding. So that's great. Bleeding to death's not a great outcome. But then you've got an injury there. So the platelets are already also stuffed full of growth factors. And there's so many growth factors: skin growth factors, blood vessel, nerve. There's like 40 or 50, and they keep on finding more and more growth factors. So a clever orthopedic surgeon in Germany 30 or 40 years ago thought about doing this, spinning the blood down, getting the platelets, injecting into bad knees, elbows, shoulders. He never was so great on doing the science and publications, but enough good reports about it that, you know, so many, you know, American basketballers and footballers, you know, were going over there to have their PRP injected into their, you know, their busted up joints. So when I had my knee meniscus injury and I asked my orthopedic surgeon, he said there's not enough evidence. And so I had the arthroscopy and had the cartilage shaved. About 3 months later, review comes out saying that maybe PRP into the knee is just as good as having surgery. I thought, well, 3 months late for me. So it's been around for a long time. Oral surgeons have been injecting it into jaws for a long time. Then a Dr. Charles Ronells in the US came up with this idea that he wanted to be injecting it into penises, which I thought was really brave because it's the clotting mechanism. So if you inject it into the penis and it clots, is it going to then sort of dry up and drop off? My understanding is that he tested it on himself first.
As every good adventurous kind of doctor will do.
Yeah, and when you're starting off in this sort of area, so good to get it on himself. And fortunately, it's turned out that after thousands and thousands of treatments, that none have dropped off. It has that allure that it's your own platelets. There's nothing injected into you. There's nothing foreign. There's no medication. It's just encouraging the body to heal itself. We've both got the same PRP machine, I think, and it generates like 10 times the concentration of platelets that's naturally in your plasma, which is about as high as any machine can get. A million platelets per mil. It is still experimental. There is really no good scientific evidence that it does what it's meant to do, is cure erectile dysfunction. But
anecdotally, what have you found with your clients?
Clients have liked it. And it's such a subjective thing. It's really hard to know. And of course, I never get to see the benefit of it. I don't know what is happening. The guys seem to be happy with it. There's a few other indications that that people use it for, and perhaps we'll discuss that in another video and podcast. So it doesn't seem to be able to cause any problems. Yes, it involves needles. Uses your own growth factor to stimulate, increase blood flow, improve nerve function in your penis. Guys seem to be happy with it. So we do it.
And one of the things I notice, for the guys who do respond positively, which has been quite a high percentage, is they notice morning erections more frequently, erections during the night more frequently. Those kind of things they didn't have before they came and saw me, which is quite interesting.
Yeah, I don't really want to say it's like this magic injection for making you 18 again, but there's certainly something about it.
Something to be said about it.
Yeah, and I really hope we get some more publications. Maybe we should be doing one ourselves, but you can't do every publication in the area.
Right. But it's worth opening the conversation and encouraging others to
and certainly when you're looking at the range of treatments that are available to you, if you're looking at what can improve the function of my penis, then the PRP injection is something that you should be considering. At least you should know about. Yeah,
definitely. All right, and I think that really there's not too many other things we haven't talked about apart from possibly the low intensity shockwave therapy. Some people ask about.
Yeah, so low intensity shockwave therapy. I think this is definitely going to be something big in the future. Certainly in Europe and now starting in the US, it's becoming more and more popular. And at least there are studies. I've got about 30 or so studies that I've seen talking about it. So it's not electric shock, guys. Don't worry. It's not low level. And don't go and get a 9-volt battery and start wiring yourself up to anything. It's really
not creating a Franken penis.
No. It's related to the machines that crack kidney stones, what's called lithotripsy. And then the smaller handheld versions have been used in physiotherapy for quite a while. I always call it the thumper. And if you experience it, you get to understand exactly why, because it has this little hydraulic jack in it and it thumps backwards and forwards. And you can do it between 5 and 20 times a second. So really thump, 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 thump. And there's something about these low intensity shock waves going into the penis that release nitric oxide, stimulate stem cells, and stimulate blood vessel growth. And this was sort of found elsewhere in the body. And then some bright spark said, well, if it's growing new blood vessels, opening up blood vessels, let's use it in erectile dysfunction. So in the last 5 or so years, lots and lots of studies coming out. They're gradually studying it for longer and longer periods and seeming to be getting benefit going out to 12, 18 months. So we have it here in the clinic in Perth. We were using it for other treatments as well. But yes, we find that guys are very keen. You know, it's not something that every guy just wants to rush in and have their penis thumped. We often combine it with the PRP shot. So they'll have the platelet-rich plasma and a series of these low-intensity shockwave therapies. But I've seen some remarkable transformations in erectile function with that. Yeah, that same sort of thing. Yeah, gone from needing the injections, Cavaject, to get an erection to waking up in the morning with erections. So they certainly do work.
Yeah, and makes sense to be combining therapies that are both stimulating blood flow into the penis.
Yeah, it sort of, it makes sense. And there's no downsides to them. It's not like a lot of the medications that there are potential side effects. For these, apart from the inconvenience of having to come in and have the treatment, that's really it.
And an interesting thing I learned from a sexual health physician that actually helped us train with our PRP device we use for the PRP into the penis was that you don't have to stop any of your other standard type of treatments. For example, the medications, they also increase blood flow into the penis. He believes if you continue to use those medications, you continue to exercise, continue to be healthy, and create as much blood flow into the penis as possible. It's like a muscle in any other part of your body. If you increase the blood flow and use it more often, it will be healthier and stronger as a result. So I guess the moral of the story is try everything, keep exercising, and keep using it.
Yeah. Not that you're saying that the penis is a muscle. We all know the penis itself is not a muscle, guys.
Correct.
Okay, there are little muscles in there, but the penis is not a muscle.
Yeah.
We all know that.
But yes, it's about getting that blood flow into the penis, it's combining multiple therapies to try and get to that solution that you want. Yeah.
Look, thanks a lot, Dr. Gav. That was great being able to talk about erectile dysfunction with you. I'm Dr. Jayson. Together we are the Dick Doctors. Guys, remember, confidence changes everything. If you've got any comments that you'd like to make about what we've been talking about, questions, feel free to post those below. And we've got some more interesting topics coming up soon.
Thank you very much for having me, Dr. Jayson. Speak again soon.
Yeah. Talk to you then.